We will now continue with an invited talk about COVID-19 with Christian Lovis. He's a Swiss board-certified medical doctor in internal medicine with a special emphasis on emergency medicine and holds a Master of Public Health from the University of Washington, Seattle. In parallel to medicine, he studied medical informatics at the University of Geneva, focusing on clinical information systems. Predicting can be seen as the ability to describe all the possible futures. COVID-19 is a good example of both situations, some predictions being built to warn, others to build capacity. They have been quite different. So welcome, Christian.
Thank you very much. So we have all experienced an incredible time these last 3 months, and we have seen that many of the elements in the reality we, most of us thought were not possible, have proven to be possible. So, and I don't think anybody would have predicted in January that in February or in March, the border between Switzerland and all his neighbors would be closed by the Swiss government. And it happened that I live in France. I work in Geneva. I am one of these Swiss guys living in France and working in Switzerland. And I used to go to my job with my bike. And suddenly, it was no more possible to cross the border. And there was a beton things stopping the road. You couldn't cross without going above the beton border. So it was an incredible experience to live this, to see that this is possible, and also to look back at some point and to say who would have predicted a week ago, a month ago, 6 months ago, that the border would be completely physically closed. So prediction is something which is proven to be difficult. There are some very famous quotes. A nice physicist, it's not so clear if it's Niels Bohr or not, but who said that prediction is a difficult art when it is about the future. And indeed, there has been a paper in the New England Journal of Medicine, mid-May, an editorial about the prediction, that they are always wrong, but they are always useful. And there is a lot to learn at reading this, as there is a lot to learn in these last 4 months about prediction and what are the learnings about these predictions. So in this paper and some other things that have been learned, I wrote here 6 questions, but there are only 5 written, because one of the difficult things is that there is always something that we miss. So what is the intention of the prediction? There are many types of prediction, reason to do prediction. And I will speak a little bit about this, but it's not the same to do prediction for planning resources or to do prediction to warn the government or to warn the population, to raise awareness. If you go more into the math of the prediction, what is the model which is used? And I speak really here at a vision of the prediction. Is it a probabilistic vision? Is it built on previous data? Is it a data-driven model? What type of approach is taken? For all the models, there are parameters. And this is all the magic of the prediction. It is finding the right parameters. It is also the power of these prediction systems is that you can play with the parameters and you can draw futures. An important point which is well raised in the New England Journal paper is about being able to express the uncertainty of the prediction. How strong, how how strong do you trust your prediction? And finally, what are the data that are used to build the models if they are data-driven? So I was speaking about the intention. Thinking about it, I found three important groups of intentions. One intention is the scenario-based prediction. They tend to draw all the possible future. There are many groups working on scenario-based prediction, and these predictions, they are more or less always the same. They have always the same philosophy. If these are the parameters, then this will be the future. And there are different types of parameters, variation of these values, and they draw different futures. And these futures are possible. Some more probable, they are all possible. The second group is the extreme-based prediction. What are the extremes? And for example, what is the future we would not like to have? Or which is the future we would like to have? And finally, there is the prediction, which is what is the most likely to happen? Because at some point, and it's what we experienced with the COVID pandemic, how many beds in intensive care units do you have to organize for next week, for in 2 weeks? Because this cannot be organized in 20 minutes. You need time to organize, to reorganize a hospital to have 500 beds of standard care, which will be devoted to an infectious disease. It requires time. You have to reorganize completely how the hospital is working. So I will take here the example of Christian Althaus. He's an epidemiologist working at the University of Bern, and he does really a good approach on prediction. They can be found on internet, and these are the predictions that were available at the very beginning of the pandemic. And you can see that they are scenario-based, and for each of these charts, you have different curves, and they draw different possible futures. And one of the important aspects of the work of Christian is that these curves, they come with a text, and this text is explaining and clarifying, making transparent all the elements I was speaking with my 6 questions. There is always one missing, but where you can find exactly the method, the model, what are the parameters, how uncertainty is handled. And this is really an important point, because you cannot use the prediction if you don't have that. Looking at the prediction, you also have completely different approaches, and you can see here, it's really something which is interesting to see. In the beginning of the crisis in the US, epidemiologists and prediction epidemiologists, infectious experts in the field have been asked to predict the situation in 2 weeks. So basically, the middle of March, they have been asked to predict what will be the situation in the US in 2 weeks. And what you can see in the chart on your right, on the right of the screen, is blue points and blue bars. The blue point is the most likely to happen situation for how many cases there will be in the US, and the blue bar is the uncertainty. So you can see, first of all, that it was strongly underestimated. Basically, they expected to have around 3,000 cases, 3,500. There have been really 140,000. But you can also see that the uncertainty from one expert to other has been very variable. And for one of the experts, the number of cases varied from a few cases, I don't remember exactly, 500 cases, to about, or 5,000 cases, to about 500,000 cases. So basically, everything can happen, which is not completely wrong, but not very helpful. So more recently, in end of April, a group has published scenario-based prediction for Switzerland. And you can see here the information about how the 5 questions have been answered. It's a scenario-based, so this is the intention. You have the method, the parameters that have been used, and then you can see at a little bit here the different possibilities that come out with this prediction. Just to come back, I just want to say something about the sentence written in big, for planning purposes only, not a forecast. It's really hard to understand this sentence. What do you mean? If it's not a forecast, how can you use it to plan? But just to say for the authors. So when you go here, you see that there are very, very different scenarios. And these different scenarios, they draw completely different futures. From a few ICU beds in July to a lot of ICU beds in July. And it's the same in June, in fact. So here, I don't know if it will work. Yes, it works. I couldn't check the system before here, but it works. So you can see the curves moving. What I do here, it's on internet. You can find the reference, and you can see a typical compartmental model, which is used for most of the prediction we have had here, to see how it moves when you move the parameters. So getting the right parameters is really the difficult science and the difficult art. Here I try to show what we have done to predict for the university hospitals in Geneva. We have used all what we can use from Switzerland, the cantons, and from France. We have used a lot of information coming from science, like the incubation, recovery time, but also information coming from the public. For example, adoption. And you can see this is in French because we were taking care of Geneva. In Lausanne, there is a place where you can do in the night parties, and it's a large place. They cut the place into 2 to be able to take all the cases below 1,000 when it was not allowed. At some point, a young girl, a teenager of 16, died. And these events in the medias have been read by the young people, the teenagers in the Romandie, and they have had an impact on how the population has adopted the public health measure taken by the government. We have analyzed 100, and we still follow 109 countries to see the cases and the mortality. And here you can see, for example, the impact of closing schools on the mortality. And we use some index, here a stringency index, where it's not dynamic here, but we can play it dynamically, where we compute for each country the temporal R0 between contamination and number of people that you can contaminate as an individual, and we compute it individually for each country and for each measure to try to learn for Switzerland. And learning for Switzerland is because there are some countries in advance compared to, for example, our country, Switzerland, and you can use other countries in Europe or on the right, China and South Korea, and then put Switzerland on these countries' evolution to see if Switzerland evolves like China, how will it be in Switzerland. And then we could use also, because we are in the hospitals in Geneva and we had to predict, so for the management of the hospitals, we could use all the patient record of all the cases. And this is a lot of data, and you can see here that we could modelize the latent event, such as age, gender, all the comorbidities, so that altogether, it's not one prediction, there are dozens of different sub-predictions for each type of population. And this is very important because it's not so visible, but on the right side, you can see these different prediction. It's for the same type, it's for the same disease, it's for COVID, but you can see that the curves are very different because it's different population. And of course, in a canton, in a country, in a region, the different population, they have different behavior, they have different contagiosity, the disease has different spread in this population. They also have a different answer to the disease. We know the children, the aged people, they don't react the same. So that we have a different curve for immunosuppressed people, aged people, comorbidities, different type of treatments, and so on. At the end, it is a very complex model, and just to have how many COVID cases, we have 17 variables to describe that. And this allows to do very, very precise prediction, but it requires extremely dense and good data. So as a conclusion, a predictive system must have a clear intention. For what is it intended, it has to be transparent. There are multiple models. All the data must be transparent, carefully used. We must handle uncertainty also transparently and properly, and the literature is an important point. Thank you very much.
Thank you, Christian. Thanks for your talk. And we got a question that came in. I'll read it from the screen on the left. Thank you for pointing out the importance of uncertainty. Any recommendation how to communicate this optimally to users of prediction models?
It's a very good question. I think that we have to be careful about the expressing the uncertainty of prediction models. For example, in my team, when we have done prediction based on events that we do where we accumulate simulation, the more simulation we did, the more precise the model became in the long term. But it's not coherent to say that the model is less precise for tomorrow than it is for in 2 months. We all know that the more futuristic is the prediction, the less precise it is in this type of case. So it's a mix on the mathematics, the uncertainty of the model itself, it's the inherent properties of the model, and a knowledge about, a kind of a heuristic knowledge about the fact that we know that, in fact, if we are more in the future, the uncertainty grows. So we have to be careful at being able to display both of them. And then technically, I think the best is just to draw it. Not to draw lines, not to give numbers, but to give intervals, to give range.
So the thing, I guess everyone's wondering, is there going to be a second wave in fall? What are your predictions? So
I think that we are experiencing microwaves constantly, and I don't think that there will be a huge wave, like an enormous wave, at least not for the same virus and everything equivalent. But I think that there will be a lot of restarts, and there will be reactions to try to avoid that it explodes, and that it will go down and up and down and up and down. Like we can see right now in Germany, where you have seen there has been 1,500 cases in one very specific cluster, and the cluster has been closed, and most probably it will just stop. So this will probably be the case, and I think what also said Marcel before, it's very important to use the Swiss COVID app. I use it. Use it.
Thanks for that. One final question. How do you deal with detractors that claim your predictions were wrong since measures were taken based on your predictions and the future was therefore changed?
Well, if you do prediction, there are always wrong prediction and good prediction. So afterwards, it's always easy to say these were good and these were wrong. The reality today is that if you look at what happened in Switzerland, there can be a lot of discussion to what was wrong and what was not wrong and so on. But the fact is, we had a low mortality rate. We didn't explode our healthcare system like in many places. The situation has been taken under control. It has had a cost. Now, probably, I don't know, it could have been possible to have the same thing with a lower cost. But the fact is, it ran well. Our prediction, they were not public. We have done only prediction for the University Hospitals of Geneva. We were very near the correct numbers, but we had completely different than the one that were available. I think a lot of people have done a lot of prediction that were extremely correct, except that the nature of the data didn't allow these predictions to be made public.
Mm-hmm. We have one more question that just came in. Same data lead to very different policy decisions. For example, Sweden versus Switzerland. How can we improve the use of these models for decision making?
Well, I am not a politician. My reputation is to be a really bad politician. I speak badly, and I never use the correct expression to say things. So I would say that the difference between Sweden and Switzerland, but it's not only Sweden, the UK, they also tried this approach. And we could speak about some states in the US today, and there are many other situations like this, Brazil and so on. What has been done in Switzerland was not to avoid a pandemic, it was to avoid that the healthcare system, that our hospitals got broken. This was the purpose. Our hospitals, they didn't got broken. So the goal was achieved, full dot. In other places, as you know, in France, in Italy, in other places, the hospitals system, they got broken. We avoid this. I think we have to recognize that. Then, if you compare Sweden and Switzerland, it's a societal difference. You accept different type of cost for different type of results. You can pay something, you can pay a result with lives, you can pay a result with money. You can pay a result with an economical burden. You can pay, there is a cost for a result. Different countries, different culture choose different costs and different results. Voilà.
Thank you, Christian. I'm sorry we have to end here because the next presenter is already out there. But
it was a pleasure, really. Thank you.
Bye.
Bye-bye.